So as I've said, Wiskot's Eldridge syndrome मा चाहिँ WAPS protein मा mutation हुन्छ. So it's tiny platelets हुन्छ. So त्यसको formula चाहिँ TI भने बुझे हुन्छ. TI को भने thrombocytopenia, immunodeficiency and eczema हुन्छ. So board bad examination, normal number of megakaryocytes, although they have bizarre morphology features. Splenectomy often occurs. The thrombocytopenia often corrects the thrombocytopenia, suggesting that the platelets formed in WAS has accelerated destruction. They might have lymphoreticular malignancy in 5 to 15% of cases, and treatment is hematopoietic stem cell transplantation. So Wiskott-Eldridge syndrome. This is also important. So neonatal thrombocytopenia, एउटा चाहिँ autoimmune हुन्छ, एउटा autoimmune हुन्छ. Autoimmune चाहिँ maternal antibodies ले गर्दाखेरि चाहिँ बच्चामा thrombocytopenia हुन्छ. अर्को चाहिँ autoimmune भने चाहिँ there is development of maternal antibody against antigen present on fetal platelets that are shared with father. And father को चाहिँ component हुन्छ जुन चाहिँ fetal platelets मा, त्यसको against चाहिँ maternal antibodies produced हुन्छ. And is recognized as a foreign antigen by the maternal immune system. So you should be knowing that neonatal autoimmune thrombocytopenia NAPT पनि भन्छ, त्यसलाई चाहिँ मदर को हैन कि फादर को एन्टिजेन लाई चाहिँ फरेन बडी ठानेर maternal immune system लाई चाहिँ एन्टिबडी प्रोड्युस गर्छ है, त्यसलाई चाहिँ NAPT भन्छ. अर्को चाहिँ मदरलाई नि के रे ITP छ भने that antibody can go to the child and cause destruction of the platelets है, यो चाहिँ NAPT भयो त. So neonatal autoimmune thrombocytopenia भने चाहिँ है. अर्को चाहिँ neonatal thrombocytopenia हुने causes-हरु चाहिँ usually congenital viral infection है, such as torch infection, rubella, cytomegalovirus, protozoal infection such as toxoplasmosis, syphilis, gram-negative bacteria भयो भने चाहिँ there are more causes of neonatal thrombocytopenia. अर्को चाहिँ fungal infection ले गर्दाखेरि पनि neonatal thrombocytopenia हुन्छ. So neonatal thrombocytopenia भयो भने चाहिँ you have to think of torch infection है. torch मा चाहिँ toxoplasmosis, AIDS पनि हुन्छ, HIV पनि हुन सक्छ, or syphilis or cytomegalovirus, rubella virus are more common है. And also gram-negative bacteria, also neonatal sepsis that can cause DIC है. अर्को चाहिँ necrotizing enterocolitis usually seen in preterm neonates मा चाहिँ necrotizing enterocolitis हुन्छ है. अर्को भनेको चाहिँ neonatal alloimmune thrombocytopenia. So it's a development of maternal antibodies against antigen present on fetal platelets that are shared with the father and recognized as foreign by the maternal immune system. So this is equivalent of RH disease of newborn. And you say RH disease of newborn, RH incompatibility of newborn, त्यस्तै नै equivalent हुन्छ. So incidence is 1 in 4,000 to 5,000 live births मा चाहिँ देखिन सक्छ. So clinical features मा चाहिँ there is generally petechial rashes or purple rashes in first week of life. So there might be intracranial hemorrhage about in case of like 30% of cases मा चाहिँ usually intracranial hemorrhage हुन्छ, either prenatally or perinatal period. Unlike RH disease, first pregnancy may be severely affected. So तिम्रो RH disease मा first pregnancy मा affect हुँदैन, तर तिम्रो NAPT मा चाहिँ first pregnancy मा पनि severely affected हुन्छ. Subsequent pregnancy are often more severely affected than the first one है त तिम्रो NAPT मा. So laboratory studies मा normal platelet, maternal platelet count, moderate to severe thrombocytopenia in newborns. Presence of maternal alloantibodies directed against the father platelets. So we can look for presence of maternal alloantibodies against father's platelets. Also, specific studies can be done to identify the target alloantigen. So most common cause is incompatibility for platelet alloantigen. So human platelet antigen 1A मा चाहिँ हेर्नु मिल्ने हुन्छ है त, HPA 1A. अर्को चाहिँ specific DNA sequence polymorphism बाट पनि we can look हैन for तिम्रो alloantibodies directed against the other antigen. So treatment is IVIG prenatally to the mother and start in the second trimester and is continued throughout the pregnancy. अर्को चाहिँ corticosteroid to mother and the infant after delivery. अर्को चाहिँ delivery should be performed by cesarean section. So after delivery, if there is severe thrombocytopenia, platelet concentrate should be added. Genetic counseling should be done in case of high risk thrombocytopenia in subsequent pregnancy. The mother's pre-existing platelet count may have some predictive value in severe maternal thrombocytopenia before delivery appears to predict a high risk of fetal thrombocytopenia. In mothers who have splenectomy, the maternal platelet count may be normal and is not predictive of fetal thrombocytopenia. So fetal thrombocytopenia पनि हुन सक्छ इभन मदरको स्प्लिनेक्टोमी किनभने त्यो अटो एन्टिबडी चाहिँ त्यही नै हुन्छ स्प्लिनले गर्दाखेरि तिम्रो स्प्लिनबाट एउटा अटो एन्टिबडी कम हुने हुन्छ तर एन्टिबडी चाहिँ प्रोड्युस त्यो प्लेटलेट कोटेड एन्टिबडीले चाहिँ that might destroy fetal thrombocyte and even the mother has undergone splenectomy. Now coming to platelet function disorders. So एउटा Glanzmann thrombocytopenia छ अर्को चाहिँ Bernard-Soulier syndrome अर्को dense body अर्को चाहिँ alpha granule deficiency भन्ने छ है dense body deficiency र gray platelet syndrome है यिनीहरु छ. So the platelet function we can do in time and interaction of platelet with the blood vessel wall. अर्को चाहिँ platelet function analyzer measures platelet adhesion and aggregation in whole blood at a high shear when the blood is exposed to either collagen, epinephrine, or collagen ATP. Both are sensitive to moderate and severe von Willebrand disease and platelet function. So platelet function currently measured by platelet aggregometry. And यो चाहिँ तिम्रो टेस्टहरु हो हैन त्यो धेरै चाहिँदैन. So okay, so talking about the disease. So occurred causes of platelet function. So causes are liver disease or kidney disease such as uremia, disorders that triggers increased amounts of fibrin degradation products, drugs such as aspirin, NSAIDs, valproic, high dose penicillin, platelet disorders, functional disorders around सक्छ. Treatment to treat the primary causes, infusion of desmopressin, transmission of platelet and cryoprecipitate. So congenital anomalies of platelet functions or Bernard-Soulier syndrome we have discussed earlier. So there is absence of severe deficiency of von Willebrand receptor. So GP1B complex deficiency also on the platelet membrane. So it's characterized by giant platelets with thrombocytopenia, and there might be prolonged bleeding time and platelet function aggregation ma chai 100 closer time huncha. So platelet aggregation test shows absent restocytin induced platelet aggregation but normal aggregation to all other agonists, and von Willebrand factor are normal. So there might be genetic mutation in gene forming GP1B complex of 2 glycoprotein 1B alpha 1B beta V and 9. अर्को चाहिँ associated Glanzmann thrombocytopenia associated with severe platelet dysfunction. There is prolonged bleeding time but platelet count is normal, right? So यसमा चाहिँ Bernard-Soulier मा चाहिँ thrombocytopenia हुन्छ है यसमा चाहिँ normal platelet count हुन्छ यसमा चाहिँ normal platelet size हुन्छ whereas in case of Bernard-Soulier syndrome there's giant platelets है. अनि restocytin test चाहिँ तिम्रो यसमा चाहिँ abnormal or absent हुन्छ in case of Bernard-Soulier, whereas in Glanzmann thrombocytopenia restocytin चाहिँ normal हुन्छ. So because restocytin agglutinates platelets and does not require a metabolic active platelet, so there is the aggregation study shows abnormal or absent aggregation with all agonists used except restocytin, right? It's caused by deficiency of platelet fibronectin receptor 2B3A, right? the major integrin complex on the platelet surface that undergoes conformation changes by inside-out signaling when platelets are activated. So mutation of 2B3A or B3, is usually Glanzmann thrombasthenia. A diagnosis is confirmed by flow cytometric analysis of patients' platelet glycoproteins. So I think this is the last slide. Or we say hereditary deficiency of platelet storage granules. So there might be dense body deficiency, gray platelet syndrome or so dense body deficiency is characterized by absence of granules that contain ADP, ATP, calcium, and serotonin, diagnosed by platelet aggregation studies and electron microscopic studies. Or say gray platelet syndrome, this means the absence of alpha granules, resulting in large platelets and appearance of gray or right stain of peripheral blood. So aggregation and release are absent with most agonists other than thrombin and ristocytin. So electron microscopic studies are diagnostic in case of gray platelet syndrome. So treatment is, in case of severe platelet function defects, we can give desmopressin for use for mild moderate bleeding episodes. So desmopressin usually timro 1 milligram factor बढाउँछ. So in case of 1 milligram deficiency, desmopressin use हुन्छ. अर्को चाहिँ Bernard-Soulier syndrome or Glanzmann thrombocytopenia, we have to give platelet transfusion, or patient refractory to platelet transfusion मा चाहिँ recombinant factor 7A दिनुपर्ने हुन्छ, or they might require hematopoietic stem cell transplantation. So these are the causes of thrombocytopenia in children as well as neonates. So if you have any questions, I will try to answer. Keisa? Can you hear me?
Yes, sir.
So do you have any questions?
No, sir.
So तिमीहरुले यसमा पढ्नुपर्ने भेरी इम्पोर्टेन्ट चाहिँ तिमीले आईटीपी एउटा पढ्नु पर्यो है, इम्युन थ्रोम्बोसाइटोपेनिक पर्फिरा पढ्नु एन्ड अप्रोच टु पर्फिरिक र्याश. सो वेल चाइल्ड हो कि इल चाइल्ड हो डिफरेन्शिएट गर्नु पर्यो. वेल चाइल्ड छ भने चाहिँ कन्जम्पसनमा के हुन्छ, अर्को चाहिँ डिक्रिज प्रोडक्सनमा चाहिँ के हुन्छ त्यो चाहिँ थाहा पर्नु. इल चाइल्डमा डिक्रिज प्रोडक्सनमा के हुन सक्छ हैन, कन्जम्पसन कोआगुलोपेथीमा के हुन सक्छ, इल चाइल्ड र वेल चाइल्डमा डिफरेन्शिएट गर्नु पर्यो. अनि त्यसपछि चाहिँ यु क्यान आफ्टर यु डायग्नोज द डिजिज हैन. अब यो आईटीपी चाहिँ इज भेरी इम्पोर्टेन्ट हैन, यो क्रोनिक एक्युट आईटीपी एन्ड वेन टु म्यानेज क्लासिफिकेसन अफ आईटीपी, नो सिम्पटम्स, माइल्ड, मोडरेट, सिभियर हैन. अनि कुनमा सिभियरमा मात्रै ट्रिट गर्छ हामीले, अर्को नो सिम्पटम्स, माइल्ड, मोडरेटमा चाहिँ वी जस्ट वेट एन्ड वाच हैन. अनि एक्युट र क्रोनिक एन्ड ट्रिटमेन्टमा पनि यु हेभ टु नो है. सो बेसिकली चाहिँ आईटीपी शुड बी फोकस इन दिस च्याप्टर हैन. अर्को चाहिँ न्यूनेटल अलोइम्युन इडियोप्याथिक थ्रोम्बोसाइटोपेनिक पर्फ्युरा है, न्याप्ट भने हामीले अघि नै पढ्यौं हैन. त्यो बुवाको प्लेटलेट एन्टिजेनलाई चाहिँ मदरको इम्युन सिस्टमले फरेन बडी ठानेर चाहिँ त्यो प्रोड्युस एन्टिबडी हैन. यो चाहिँ आरएच इन्कम्पेटिबिलिटी जस्तो हुन्छ, तर फर्स्ट बेबीमा चाहिँ पनि इन्फेक्सन फर्स्ट बेबीमा नि इट क्यान अफेक्ट है, unlike RH incompatibility. So यिनीहरु चाहिँ you should be knowing है त. सो भोलि तिमीहरु कति बजे भ्याउँछ त क्लास लिन?
सर 9 to 12 बाइक और टाइमिङ मा मिल्छ सर.
हजुर
सर 9 to 12 बाइक चाहिँ अरु टाइमिङ मा चाहिँ मिल्छ सर क्लास लिन.
त्यसैले 5 to 6 पनि हुन्छ?
हुन्छ सर.
र एकचोटि डिस्कस गर्छ, हुन्छ भने म 5 to 6 लिन्छु, किनभने भोलि हाम्रो यो रेजिडेन्टहरुको पनि प्रेजेन्टेसन छ कि, त्यही भएर.
हुन्छ सर, भोलि 6 गरौँ न.
तिमीहरुको 5 to 6 मिल्छ भने म लिन्छु 5 to 6.
हस्.
हुन्छ, थ्यांक यू.
थ्यांक यू सर.
Thank you, sir.
Thank you, sir.
Thank you, sir.
Thank you, sir.